either goggles or face shield, or there is a face shield available which comes along with the mask. So it is so it solves both the purpose. It comes along with the 3-ply mask. So 3-ply mask comes along with the face shield. Either you can wear this, otherwise you can wear the face shield separately, or you can wear the goggles. The basic difference between goggles and face shield is goggles will fit onto your eyes tightly. It will not give a cover over your face area, whereas face shield will give a cover of the entire face area, so it has a larger area of protection. Okay, so please remember, when you don the goggles or the face shield, you have to place it over your eyes. If it is a goggle, place it over your eyes. If it is a face shield, place nicely over your face and pull the strap tight. The strap you have to pull tight so that it will fit nicely over your face. Now now we will have a demonstration of donning of goggles and face shield. After donning of the goggles, the next step and the last step of donning is donning of gloves. Okay, so when you don the gloves, the steps are like this. The first step is you have to wear the first glove. First glove, the glove will have two gloves, the right pair of the glove and the left pair of the glove. So you have to wear the first glove, and when you wear the first glove, you have to wear by touching and pulling the edge of the cuff only. So please remember, don't touch the front part of the glove. You have to only pull the edge of the cuff. Don't touch the front part of the gloves. So after that, you have to wear the second pair of the glove. So when you wear the second glove, you must avoid touching the forearm skin by pulling the external surface of the second glove by the finger of the gloved hand. Okay, so this is the finger of the gloved hand. So by this you have to pull the wrist strap of the glove of the second pair of the glove, and make sure that you are not touching the forearm skin. So when you pull, you are not touching the forearm skin. So you have to make sure that you are, without touching the forearm skin, you have to pull the second glove nicely. So now we will have a demonstration of donning of gloves. So this is all about the donning of the PPE. Now we will have a demonstration of doffing of the PPE. Doffing of the PPE is extremely important. In fact, the sequence of doffing, the method of doffing, 100 times more important than donning method, because your PPE will be fully contaminated. So when you doff, when you remove the PPE, if you do not follow the specific sequence, if you do not follow the specific method of removal, there is always a chance of cross contamination, and that is how you will get the infection from the patient. Okay, so please remember, these are the steps of doffing of PPE. The first thing is removal of gloves. Gloves are the last step of donning, and gloves are the first step of doffing. The most contaminated area of your body is your gloves. That has to be doffed immediately. After that, you have to remove the goggles or the face shield, whichever you have worn, that you have to remove. Then you have to remove the gown, and at the end you have to remove the mask or the respirator. After that, you have to perform hand hygiene. So these are the steps what you have to do. And remember that hand hygiene, of course, you have to perform at the end. However, hand hygiene between each step may be needed if there is a risk of contamination. While you remove the PPE one by one, if there is a slightest risk that your hands are contaminated with the dirty PPE, then you may have to perform hand hygiene in each step. You may have to perform hand hygiene in each step, or otherwise at the end you have to perform hand hygiene. Another important point is, after you remove the PPE, each PPE when you are removing, you have to discard into the appropriate biomedical waste bin. So again, a point to be noted that all the plastic PPE has to be discarded into the red bin, and non-plastic PPE has to be discarded into the yellow bin. For example, plastic goggles or face shield as well as gloves has to be discarded into the red bin, whereas gown, mask, this PPE has to be discarded into the yellow bin. Okay. The next point what you need to be remembered is, doff all PPE before exiting the patient room except the mask. Okay. All the PPE need to be doffed inside the patient room just before you come out, except the mask. The mask or the respirator has to be doffed outside the patient room. So after you remove other PPE, you have to come out. Then you have to close the door of the patient isolation room. Then you have to remove the mask and you have to discard, and you have to perform hand hygiene. So please remember, mask is the only PPE which has to be doffed outside the patient care room. Now we'll have a demonstration of the doffing of the PPE. The first step of the doffing is removal of the gloves. Glove removal is very tricky. You have to know the technique properly. Before you doff, you have to keep in your mind that do not touch the outside area of the contaminated gloves. So you should not touch the bare hand. With your bare hand, you should not touch the outside area of the contaminated glove. You should not touch. Make sure that you are taking the gloves only by touching the side, not by touching the outside area. Okay, the first step of glove removal is using a gloved hand, grasp the palm area of the other glove hand and peel off the first glove. Okay, so using the glove hand, grasp the palm area of the other glove and peel off the first glove easily. Then the second step is, so when you peel off the first glove, your one hand is naked, bare hand, other hand will have one more glove. So what you do is, in your bare hand, the finger of your bare hand, you have to put inside the second glove in the wrist area. Okay, so hold the removed glove in the gloved hand, hold the removed glove in your gloved hand, and then slide the finger of the ungloved hand under the other glove at the wrist area like this. Then peel off the second pair of the glove. After that, the first glove will remain inside the pouch of the second glove. Okay, the first glove will remain inside the pouch of the second glove. Then you have to discard the glove into the red bin, and if you feel that your hands are contaminated, you may have to perform hand hygiene. Now we will have a demonstration of glove removal. After glove removal, the next doffing step is removal of the goggles or the face shield. So make sure that you have to hold the goggles or the face shield only by the side straps. Only by the side strap you have to hold. Don't touch the front area of the goggles or the face shield. Only by the side strap you have to hold, and slowly you have to bend forward. Remember, bend forward and slowly remove the goggles. Do not touch the front part. Always bend forward. Why the bend forward is required? Because if you sit straight and remove, then the droplets over the face shield may fall over your body. Okay, so a little bend forward and doff the goggles or the face shield. Now we'll have a demonstration of removal of goggles and face shield. After removing the goggles, the next doffing step is removal of the gown. Okay, so the gown removal, again the most important step is do not touch the front part of the gown. So never touch the front part of the gown in your naked hand. In your bare hand, don't touch the front part of the gown. The first step here is unfasten the gown tie. Okay, unfasten the gown tie, taking care that the sleeves do not touch the body when reaching for the tie. So please remember, when you are unzipping the tie, you should make sure that the inside of the cloth you should not touch with your sleeves of your gown. Okay, so unzip the gown, untie the gown, but make sure that your sleeves should not touch the inside of your cloth. Then the second step is remove the gown. But when you remove the gown, always touch the inside of the gown. So what you do is, if this is the gown, make sure that you have to touch the inside of the gown like this, inside of the gown, and then you have to remove in a way that it should be away from the neck and soldiers, touching only inside of the gown. Please remember, you should not touch outside the gown and you remove, only touch inside of the gown and you have to remove the gown. So when you remove the gown, please remember that turn the gown inside out. This is the most important step. Turn the gown inside out and roll it into a small bundle and discard into the yellow bins. And if you, by chance, if you feel that you have touched the front part of the gown, then you have to perform hand hygiene after its removal. So now we will have a demonstration of doffing of the gown.